Okay, these are some tips for people who do ECochG. I've been doing this for 40 years, so I have seen all kinds of problems. Today, with our equipment, with the type of processors that we have, digital processing that has evolved through many algorithms over the years and has become so high performance, noise immune, we're getting much better results. We're able to do things that couldn't be done in the past. But things that'll help. The shorter test leads. The TM electrode leads that we recommend, those rounded alligator clip leads, special leads that come with the Interacoustics Eclipse, they are shorter than the other tip-trode leads, those alternative tip-trode leads, and therefore they'll pick up less electrical interference. So if you're having electrical interference problems, using those, that alone might solve it. And in many cases it does, just that. It's like a miracle. Important to consider the lead dress, and by that I mean keeping the electrode leads separate from the insert receivers. Don't have them wrapped around or running across the inserts themselves when you have them clipped onto the patient's clothing. Just keep them separate so we're not picking up a stimulus artifact. If you have to use long electrode leads, like they're 42 inches or something like that, consider braiding them along with the ground electrode. All right? That acts as a type of a shielding. Remember the electrode impedance match. All electrode impedance is below 5K, and the electrode impedance of right and left tip-trode are within 3K of one another. The low-pass filter, that's the high end of the band pass. If you had it at 2,000, if you had it at 3,000, lower it to 2,000. If you had it at 2,000, you could even go to 1,500 or even squeeze it down to 1,000 if you had to. All right? I'd rather a little bit broader, like we originally recommended, but you could squeeze that down. Don't change the high pass. If it's 1 hertz, you can move it up to 5 hertz, but don't go any further because you're going to obscure the summoning potential. Okay? That's important. A power line filter. The brand name that we use is Monster. You can get it at Best Buy. And it's not in the computer section. It's in the audio section. And it's not, it looks like it just looks like a regular bar of electrical outlets, right? An outlet strip. But it's a special outlet strip that has a line filter in it, AC line filter in it. And it makes a big difference where interference is coming through the power system of the building, okay? So that power line filter is excellent. It costs you about $129, and in many cases, we plug the equipment into that, and presto, interference disappears, okay? Also, on a system like the Interacoustics Eclipse, we have offline digital filtering. So we can filter the response even after we get it. We say, boy, we'd like it to look a little bit better, and we can tweak the filtering even though it's done, as if the filters were originally set somewhere else. Another thing we could do if we want to enhance the response, increase the amplitude a little bit, get a little bit of better wave morphology and repeatability. Remember, if it doesn't repeat, if it doesn't replicate, you have to investigate. Right? That's necessary to know you got an actual response and not just a random response. Anyway, we could use a horizontal montage. In other words, instead of collecting from CZ to the ear canal, we would collect between the two ear canals. So that would take a rearrangement of the electrodes, but it could be done because that will give you a higher response. And if you can't identify the summoning potential, there is a little trick. Sometimes it's on the leading edge of the action potential, but it doesn't have a little edge on it that you can mark with experience. It's just like it's almost not there. If it isn't, this case is probably normal, because if it was abnormal, that summoning potential would be exaggerated. But anyway, in order to find it, what you can do is increase the stim rate. Increase it to 30, 40, 50 clicks per second. You will diminish the action potential, but the summoning potential should then stand out. Okay? It's a little trick that could be helpful in certain cases. Remember to use the smaller of the tip trodes. What you would normally think was an insert earplug for pediatric. You can use those on most adults unless they have a huge ear canal, so that you can get a very, very, very deep insertion. Don't be afraid of it. That's what makes all the difference in the world. Make sure when you clean the ear canal, in order to get super low impedance, you're doing it with an abrasive, right? Like New Prep, right? You can use alcohol on a Q-tip, but also New Prep. So you're degreasing and abrading the skin in the ear canal. And of course, a very deep placement makes all the difference. So those are the tips that will help anybody who's already doing this test, and we hope that this presentation has helped you in knowing all the alternatives and giving you some tips that will improve the results that you're getting.